So who is suitable for lens replacement? Well, really, we are looking for patients who are showing signs of early cataract, because then when we're undertaking lens replacement surgery, we're addressing the pathology. We are removing a lens that is compromising their quality of vision and taking that opportunity to utilise the best lens technology to give that patient really good distance vision, and if we use multifocal lens technology, give them near vision as well as distance vision. Now, to get the best performance out of that lens technology, we're also looking for patients who had a good visual history, and by that I mean that in their childhood they learned to see well, so both eyes have good visual potential. Children learn to see in the same way they learn to walk, talk and do everything else. Babies are born with poor vision. So our ideal candidate is someone who, albeit with spectacles, was able to see well with each eye and have those eyes work well together. It also helps if our patients have a really good tear film, and it's very common in modern life to see patients with a dry eye tendency. And whilst we all know that that phrase is associated with a feeling of discomfort in the eyes, because the tear film is the first optical surface, it affects the quality of the vision. If the surface of the eye is a bit dry and a bit smeary, actually that can affect your vision and you won't see so well. And so, because I know this will impact how a patient does after lens replacement or cataract surgery, we look carefully at the quality of the tear film when they come for an initial assessment at Custom Vision Clinic. And not only do we have excellent slit lamps and conventional examination, we have a device called an HD analyzer, which allows us to objectively assess the quality of that patient's tear film. We also have a careful look at the patient's optic nerve structure and retinal structure. This is a bit like the film in an old-fashioned camera. So the cornea and the crystalline lens are like the lenses in an old-fashioned camera, and the retina is like the film in that camera. Now, clearly for a good picture, all of the components need to be working well. The lenses need to be clear and in focus, and the film needs to be of good quality to make the most of the image that's being focused on the back of the camera. And so if we are going to undertake early cataract surgery or lens replacement surgery and use a very high performance multifocal lens, we need a really good healthy retina to be able to benefit from that and for the patient to get the most out of the technology. So those are some of the things that we're looking at when we are meeting a patient for the first time at Custom Vision Clinic. Do please take our eye surgery self-test. It's fun and moves along nice and quickly, so it won't take much of your time at all, and it will give you an idea of your possible suitability for treatments and hopefully encourage you to take the next step so that we can assess you here at the clinic. If you book in for a consultation with me, we will be able to go into much more depth about the health of your eyes and the ways in which we can improve your vision and improve your quality of life.